Hello, paramedic Noah Moore with Onslow County EMS. Today I'm doing a presentation on the pain control protocol, the newly updated protocol for the Onslow County EMS system. Pain control protocol is Universal Protocol 11. The purpose of the pain control protocol is to assess and treat pain in patients assessed and treated by EMS providers. The protocol outlines the standard treatments for all levels of pain that a patient may have. Medications in the protocol. First medication in the protocol is ibuprofen. Ibuprofen is an NSAID. It's also antipyretic. It's also a non-narcotic analgesic, which means it reduces pain and also reduces fever. It also reduces inflammatory response through chemotaxis, which is basically medication response to reduce the swelling chemically. It's indicated in fever, pain, and inflammation reduction. Contraindications are allergy or hypersensitivity. The dosage is 10 milligrams per kilogram PO, which is 400 to 800 milligrams in a typical adult, with a maximum of 800 milligrams. The next medication in the protocol is acetaminophen or Tylenol. It is also an antipyretic and a non-narcotic analgesic. It reduces pain, it reduces fever. Its indication is fever or pain. Contraindications are allergy or hypersensitivity, or liver damage or disease, or esophageal varices. Its dosage is 15 milligrams per kilogram PO. Typical adult receive 325 to 1,000 milligrams with a maximum of 1,000 milligrams. Next medication protocol is aspirin. Aspirin is an NSAID, an antiplatelet aggregator, and an antipyretic. It will reduce fever, it will reduce inflammation, and it will reduce pain. It is indicated in chest pain and in other types of pain. It's not to be given to anybody under the age of 16 or anybody with a bleeding disorder, or anybody with an allergy to the medication. Its dose is 324 to 650 milligrams PO in the adult. Torlac or Toradol is the next medication in the protocol. It's an NSAID, it's an analgesic, it's an antipyretic. It will reduce fever, it will reduce inflammation. It's indicated in pain, specifically used most of the time in flank pain or minor musculoskeletal pain. Contraindications are allergies, renal dysfunction, possible surgical candidacy, suspected stroke, or pregnancy. The adult dose is 30 milligrams IV or IO, or 60 milligrams IM with a maximum of 60 milligrams. The pediatric dose is 0.5 milligrams per kilogram IV, IO, or IM with a maximum of 30 milligrams. Next medication in the protocol is nitrous oxide. It is a gaseous analgesic and a gaseous anesthetic. It is a potent analgesic and a weak anesthetic. It's also a CNS depressant with analgesic properties. Its indication is pain, usually musculoskeletal in origin. Contraindications would be hypersensitivity, altered LFC, active COPD, traumatic chest injury, suspected pneumothorax, abdominal pain with distension, decompression sickness, and pregnancy, although it can be used in active labor. It's usually not used throughout the pregnancy. Its dose is in a 50-50 mix. It is self-administered by the patient. And another contraindication would be the patient no longer being able to hold the mask to their face. Next medication in the protocol is fentanyl. Fentanyl is an opioid analgesic. It combines with the receptor sites in the brain to produce potent analgesic effects. Severe pain is its indication. Its contraindication is respiratory depression, hypotension, head injury, dysrhythmias, and any hypersensitivity. The adult dose is 50 to 100 micrograms IV, IO, IM, or IN. Repeat 50 micrograms every 5 minutes with a maximum of 200. Pediatric dose is 1 microgram per kilogram, IV, IO, IM, or IN. May repeat 0.5 milligrams per kilogram every 5 minutes with a maximum of 2 micrograms per kilogram. Next medication in the protocol is Dilaudid. It's an opiate analgesic. Binds the opiate receptors in the spinal cord and the central nervous system, altering perception of the painful stimuli while producing CNS depression. It also subdues a cough reflex and decreases GI motility. Its indication is severe pain. Contraindications: respiratory depression, hypotension, head injury, any hypersensitivity, or any undiagnosed abdominal pain. The dose is 1 milligram IV or IO and may repeat that 1 milligram in 20 minutes. Use of the protocol. The pain control protocol begins, like all other protocols, with the patient assessment, and a few key pieces of information must be gathered prior to treating a patient using this protocol. The information gathered are as follows. Age. This is due to there being treatments within the protocol that are age specific, such as patients being pediatric. Also discussed later in the pearls, older patients, geriatric patients. The location of the pain, where the pain is located is important to treatment. Different, as discussed in the medications, different pain medications for different areas in the body. It's useful to know the location of the pain. How long the pain has persisted. Is the pain new? Is it been persisting for years? Severity of the pain, denoted on a scale of 1 to 10, or the Wong-Baker FACES scale, which is down there at the bottom. That's for children, which can help you assess which pain medication to give based on the severity and any past medical history. Once again, this helps determine if the pain is new or related to any past medical condition. Obtaining current medications is important. Medications may contraindicate any treatments. They may already be taking the medication or have taken the medication recently that you were about to give them. Allergies. If they're allergic to the medication you'll be giving, you wouldn't want to give it, so obtaining their allergies is always an important thing. Quality of the pain, how it feels, sharp, dull, stabbing. Radiation of the pain. This may help you determine the conditions that are causing the pain and help you treat the pain better. Movement. Does the pain increase or decrease with movement? If it increases or originates with movement, stabilizing the area may decrease the pain, allowing you to not have to give as strong of a medication to treat the pain, or as much medication to treat the pain. Palpation. If the pain increases with palpation, it'll help you occasionally identify an underlying cause and assist you in treating it more appropriately. These are the pearls. These must be taken into consideration when using the protocol. The recommended exam, which we just went over, also a mental status and a neuro exam. Like as said earlier, the pain severity should be recorded in the report prior to and after pain medication is given. Monitoring the blood pressure due to hypotension being a contraindication for many narcotics. Monitoring the blood pressure is very important. Both arms of the treatment in the protocol, which you'll see very shortly, may be used in concert. They may be used together. For patients with moderate pain, you can use some oral pain, some IV medication, or some IM medication to maybe treat the pain better. Pediatrics, as discussed earlier, use the Wong-Baker FACES scale to better assess their pain. Vital signs should be attained before, 10 minutes after, and at the patient handoff with all pain medications. Patients who receive any IM or IV medications must be observed 15 minutes for drug reaction in the event no transport occurs. As discussed earlier, you don't want to administer any PO medications to any surgical candidates due to them not wanting any PO meds in their system prior to going to surgery. Toradol and ibuprofen should not be used in a known renal disease or any renal transplant, or any drug allergies to NSAIDs, active bleeding, headaches, abdominal pain, stomach ulcers, or in surgical candidates. Tylenol should not be given to anybody with a liver disease, as discussed earlier. And burn patients may require higher than usual opiate doses to titrate adequate pain control, and consider antiemetics for any nausea or vomiting that pain medication can cause. Once all of these things have been considered, you may proceed through the protocol. This is the protocol. As you can see, it's got two separate arms. It's got a mild arm, which has your ibuprofen, your Tylenol, your aspirin, and IV procedure if indicated. It's got the moderate to severe arm, which starts out with Toradol, the cardiac monitor, nitrous oxide, fentanyl, and then Dilaudid. It's kind of a last go-to. And then monitoring, reassessing, and notifying the destination or contacting medical control if you feel that you need a higher dose or a different route to go about treating this pain. Changes from the previous protocol. In general, they combine the adult and pediatric protocols. Ibuprofen received no changes. Acetaminophen received no changes. Aspirin received no changes. Toradol received no changes. Nitrous oxide has been added to the protocol. It was not in the previous protocol. Morphine has been completely removed from the protocol. Fentanyl, the adult dose has changed from 1 microgram per kilogram to the flat dose of 50 to 100 micrograms, and a repeat dosing has been changed from 25 micrograms every 20 minutes to 50 micrograms every 5 minutes, and the pediatric doses or maximums have not changed. Dilaudid has been moved to later in the protocol, only to be used if no relief with the other pain medications. Any questions?